The House of Representatives is considering a new budget. This budget is making significant changes. One of the biggest changes is cuts to healthcare programs. These cuts total $880 billion over 10 years. The cuts are controversial. Many people are concerned about how the cuts will impact healthcare access. This budget is part of a larger plan. The plan aims to reduce the federal deficit. It also aims to extend tax cuts from a previous administration. The proposed cuts target two main programs, Medicare and Medicaid. These programs provide health care to millions of Americans. The cuts are facing opposition from many groups. Doctors, hospitals, and patient advocacy groups are speaking out. They argue that the cuts will harm vulnerable Americans. They also say the cuts could strain the healthcare system. The debate highlights the challenges of balancing the budget. It also shines a light on the importance of affordable healthcare. The outcome of this budget proposal remains uncertain. It is unclear if it will pass in the Senate. The debate is sure to continue. What is clear is that the stakes are high. The decisions made now will have a lasting impact on healthcare. The impact will be felt by millions of Americans. Medicaid is a government program. It provides health insurance to millions of Americans. This includes low-income adults, children, pregnant women, elderly individuals, and people with disabilities. The program is jointly funded by the federal government and states. Medicaid is a lifeline for many. It provides access to essential healthcare services. This includes doctor's visits, hospital stays, and prescription drugs. The proposed budget includes significant cuts to Medicaid. One proposal is to cap federal funding for the program. This would shift costs to states. States would then have to make difficult choices. They might need to reduce eligibility, cut benefits, or reduce provider payments. Another proposal is to impose work requirements on Medicaid recipients. This means able-bodied adults would need to work or participate in job training to qualify for coverage. These cuts could have a devastating impact on millions of Americans. Many could lose their health insurance entirely. Others might face higher out-of-pocket costs. This could lead to people delaying or foregoing necessary care. Ultimately, it could lead to poorer health outcomes and increased healthcare costs in the long run. The impact would be particularly severe in states that have expanded Medicaid under the Affordable Care Act. Despite the potential consequences, proponents of the cuts argue they are necessary to control government spending and reduce the deficit. They argue that Medicaid has become too expensive and that reforms are needed to ensure its sustainability. They also believe that work requirements will encourage people to become self-sufficient and reduce dependency on government assistance. However, opponents counter that these arguments are short-sighted and that the cuts will ultimately harm the most vulnerable members of society. Medicare is another vital healthcare program. It serves over 60 million elderly and disabled Americans. Unlike Medicaid, which focuses on low-income individuals, Medicare is available to all Americans 65 and older who have worked and paid into the system. The program is funded through payroll taxes, premiums from beneficiaries, and general government revenue. Medicare offers various plans including options for hospital coverage, medical insurance, and prescription drug benefits. It plays a crucial role in ensuring that seniors and individuals with disabilities have access to quality health care. The proposed budget also includes substantial cuts to Medicare, albeit smaller than those to Medicaid. One proposal is to gradually raise the eligibility age for Medicare from 65 to 67. This change, proponents argue, would align Medicare with Social Security's retirement age and reflect increasing life expectancies. However, critics contend that it would leave a gap in coverage for those between 65 and 67, potentially forcing them to purchase more expensive private insurance or forego coverage altogether. Another proposal involves increasing premiums for higher-income Medicare beneficiaries. This means wealthier seniors would pay more for their coverage, while lower-income individuals would see smaller increases or no change at all. Supporters argue that this change would make Medicare more financially sustainable by asking those who can afford to contribute more to do so. They also believe it would help reduce the federal deficit. However, opponents counter that it would create a two-tiered system, with wealthier seniors receiving better benefits than their lower-income counterparts. The proposed cuts to Medicare have sparked widespread concern among seniors and disability advocates. They fear that the cuts will reduce access to care, increase out-of-pocket costs, and erode the program's safety net. They argue that Medicare is already a lean program and that further cuts would jeopardize the health and well-being of millions of Americans. The debate over Medicare cuts highlights the challenges of balancing fiscal responsibility with protecting social programs that are essential for the health and security of millions of Americans. The proposed cuts to Medicare and Medicaid have drawn sharp criticism from Democrats, who argue that they would harm vulnerable Americans and disproportionately impact low-income families, seniors, and individuals with disabilities. Democrats have vowed to fight the cuts tooth and nail, accusing Republicans of prioritizing tax cuts for the wealthy over the needs of working families. They argue that the cuts would reverse progress made under the Affordable Care Act in expanding healthcare coverage and would create a less healthy and less secure society. Republicans, on the other hand, defend the cuts as necessary to rein in government spending and reduce the deficit. They argue that Medicare and Medicaid are on an unsustainable path and that reforms are needed to ensure their long-term viability. They contend that the proposed changes would introduce greater efficiency, reduce waste, fraud, and abuse, and give states more flexibility in administering the programs. They also emphasize their commitment to protecting the most vulnerable beneficiaries while ensuring the program's sustainability for future generations. The debate over Medicare and Medicaid cuts is likely to dominate the political landscape for months to come. It is a debate that cuts to the core of American values: the role of government, the importance of healthcare, and the responsibility to care for the most vulnerable members of society. The outcome of this debate will have far-reaching consequences for millions of Americans and could reshape the healthcare landscape for generations to come. As the political battle rages on, it's crucial to consider the long-term impacts of the proposed budget cuts on the healthcare system. Experts from various fields have weighed in, offering their insights and predictions on how these changes might affect the quality of care and access to services for millions of Americans. Healthcare economists warn that reducing funding for Medicare and Medicaid could lead to a significant decrease in the number of healthcare providers willing to accept these programs. With lower reimbursement rates, doctors and hospitals might struggle to cover their costs, potentially leading to closures of clinics and reduced availability of services, especially in rural and underserved areas. Public health experts raise concerns about the potential rise in uninsured rates. If Medicaid eligibility is tightened and coverage options are reduced, more individuals might find themselves without affordable healthcare options. This could lead to delayed treatments, worsening health outcomes, and increased reliance on emergency services, which are often more costly and less effective in managing chronic conditions. Moreover, the proposed cuts could have a ripple effect on private insurance markets. As more people lose access to Medicaid, there could be an increase in demand for private insurance plans, potentially driving up premiums and out-of-pocket costs for everyone. This could further strain the financial resources of middle and lower-income families, making healthcare even less accessible. On the other hand, some policy analysts argue that the proposed reforms could lead to more efficient use of resources. By cutting waste, fraud, and abuse, and introducing greater flexibility for states, there might be opportunities to innovate and improve the delivery of care. However, these potential benefits are highly uncertain and depend on how well the reforms are implemented. Ultimately, the long-term impact of the proposed budget cuts will depend on a complex interplay of factors, including how states adapt to the changes, the response of healthcare providers, and the overall economic climate. What is clear is that millions of Americans stand to be affected, and the stakes could not be higher. As this debate continues to unfold, it is essential to stay informed and engaged. The future of healthcare in America hangs in the balance, and the decisions made today will shape the health and well-being of generations to come. Thank you for watching. If you found this information helpful, please like, share, and subscribe for more in-depth analysis on critical issues. Until next time, stay informed and stay healthy.